people have never actually heard of it. Here to talk more about Essential Tremor Awareness Month is Dr. Nikita Urval, a neurologist for Hartford Healthcare. Thank you very much for joining us this afternoon.
Thank you for having me.
Well, let's just begin by you telling us exactly what is essential tremor and how is it diagnosed?
Sure. So essential tremor is uncontrollable shaking or tremor of the hands, though it can affect other parts of the body, including the head, the voice, legs. And it happens more when you're trying to do things with your hands. And it's diagnosed actually by seeing a doctor, primarily a neurologist, to make that diagnosis.
So why is awareness so important when it comes to essential tremor?
As you mentioned, it affects 7 million people in America. It's very common in adults, but a lot of people don't know about it or aren't aware of it, and it can really affect quality of life. So it's important to raise awareness so that people can get the help that they need.
And speaking of quality of life, exactly, explain for us, how does it affect it?
So it can make day-to-day tasks really difficult. So things like eating, drinking, handwriting, all of the things get troublesome. And then also, the shaking can cause some social embarrassment for some people, can make you very self-conscious.
And finally, of course, what everyone wants to know, how is essential tremor actually treated?
So there are a lot of different treatments, which is great. And it really depends on how bothersome the tremor is to a person. So there are things like weighted utensils and things that don't involve medications. There are, of course, medicines that we can use. You can also get injections into different parts of the body to help with the tremor. And then, of course, there are surgical options. So I think the important thing is to, see your neurologist, see your movement disorder specialist, and learn about the options out there, because I think there's something that can fit everybody depending on what they need.
Sure. Now, of course, we also hear about Parkinson's. How would this differentiate between Parkinson's and tremors disorder?
Sure. So the tremor looks different for Parkinson's versus essential tremor. And it's a really great question, because I think a lot of people know about Parkinson's and maybe don't know as much about essential tremor. So again, this is a diagnosis that's made by a doctor. There's not a test that definitively tells you one way or another. But for us, it's the way that it looks. It's all the other symptoms that are associated with it. And they're treated differently. So it's important to make that distinguish.
All right. Thank you very much, Dr. Nikita Urval. Thank you very much for joining us this afternoon. You have a good rest of your day.
You as well. Thank you.